presentation. Welcome you to a special Parent University virtual presentation, Coping with COVID. Before we begin our presentation, I want to, number one, just emphasize the district's perspective in terms of the health, safety, and well-being being the priority for not only our students, but our families and our staffs. It's something that you need help with or support with, please do not hesitate to reach out to us, be it myself, school counselor, teacher, administrator, whatnot. We're here to support you during these unprecedented. Anxious feelings, worries, fears during these difficult circumstances that we're all under. We're going to be sharing coping strategies, supports, resources on how to overcome social distancing, isolation, being quarantined, and whatnot. I'm joined today by 4 of our Rutgers University behavioral health clinicians. If you're not familiar, we entered into a partnership with Rutgers University Behavioral Health 2 years ago. We're now fortunate to have 4 school-based clinicians that assist our staff, not only with acute crisis situations, but support our school counselors, our child study teams, our teachers, and the mental health needs of the broader school community. So they continue to be a great resource for us here today. Side note, we will post this presentation. It's also being recorded. So we will post this on the district website. We'll also post the slides with the talking points on the district's YouTube page in the coming days. So if you know somebody that misses today's presentation, please forward that information to them as well. MK, if we could go to the next slide, I want to just briefly highlight some things with regards to our partnership with Rutgers University Behavioral Health. As I mentioned before, our clinicians do a fabulous job supporting us with any on-site crisis intervention and screenings. They assist us and assist families to access mental health services and support families through the process if there's a student that's in crisis. They also provide a lot of mental health awareness and staff professional development for our teachers, our school counselors, our child study team members. They also work with other providers well beyond just Rutgers University Behavioral Health, other mental health providers that can support our families. So making referrals and supports. To that end, I'd like to just briefly introduce our clinicians. I'm joined by Jennifer Colello. She is based at High School North. Mary Kate Harty. She is based at High School South. Natalia Pietroske. She is based at Community Middle School. And Abby Farrat is based at Grover Middle School. They do serve students K-12, even though they're housed at the middle school and high school. So with that being said, I'm going to turn it over to Mary Kate Harty to start today's presentation. And just a reminder, if you can mute your microphones and certainly use the chat feature to ask questions, which we will take on a general basis at the end of today's presentation. Thank you so much and be well.
Thank you for the introduction, Lee. I'm Mary Kate Harty, the UBHC clinician at High School South. I will be presenting this with my fellow clinician, Jennifer Colello, and our other 2 clinicians will be monitoring the chat function and taking note of questions in order to address all questions that you have at the end. So moving on to our first slide, COVID-19, what is it? So the coronavirus disease, or COVID-19, is a respiratory illness that can be spread from person to person. Reported illnesses have ranged from mild symptoms to severe illness and death for confirmed coronavirus disease cases. These symptoms may appear anywhere from 2 to 14 days after exposure, based on the incubation period. Symptoms include fever, cough, and shortness of breath. The CDC has highlighted that the cough has been described as a dry cough in your throat and not a wet cough in your chest. Older adults and people who have severe underlying medical conditions like heart or lung disease or diabetes might be at higher risk for developing more serious complications from the illness. So we highlighted some terms that have been associated with COVID-19. So the first one being social distancing. So that's maintaining enough distance between you and another person to reduce the risk of exposure and decrease the spread of the virus. So the CDC is recommending that there be 6 feet between you and another person if you do not reside in the same residence. Community spread and transmission. When someone gets infected without knowingly being in contact with someone who is infected. And so this illness is spread quite frequently through respiratory droplets, as we said, and so the community spread is quite widespread. Term quarantine, separating people identified as testing positive for the virus or those who might have come in contact with someone who tested positive for the virus. Slightly different from self-quarantine, which is someone who is asymptomatic, so not sick, they don't have any symptoms, no fever, no cough, but they have come in contact with someone who may have had the disease. So self-quarantining is when you think you might have possibly come in contact with it, and you are staying home for 14 days for the incubation period, because as we said, it could take 2 to 14 days for symptoms to appear. And self-isolating is someone who's symptomatic, sick, has symptoms, and are self-isolating within their home. So we're social distancing from people in different households. Typically, if you are not exposed or do not have the disease, you do not need to self-isolate within your home. However, if you are sick, you would isolate to a different bedroom, use a different bathroom for at least 3 days until after you no longer have a fever in order to try to mitigate the spread to other people within your home. So this slide is going over what it looks like, particularly in New Jersey right now. So a statewide curfew was enacted on March 16th. However, that's been superseded by the stay-at-home order. So initially on March 16th, the governor had a curfew from 8 p.m. till 5 a.m. But on March 21st, Governor Murphy enacted Executive Order 107, which is saying New Jersey residents should stay at home unless obtaining essential goods or services. And on the New Jersey State website, they have a list of essential services and businesses that are still open. So what that means is that there is no longer a need for a curfew because you should not be going out at any point in time unless you are obtaining essential goods and services or you are an essential employee. So visiting other states, residents that have been directed to self-quarantine for 2 weeks if visiting New York, as the state's experiencing a high volume of cases. Other notable things happening in New Jersey is that the state taxes deadline has been extended to July 15th, and the closure of public spaces. Recently, all parks have been closed in New Jersey in order to try to continue social distancing. So parks, dog parks, most beaches, hiking areas, all of those have been closed off. So COVID-19 and West Windsor Plainsboro. So West Windsor Plainsboro schools switched to virtual learning on March 16th, as most of you know. As of right now, the schools will remain closed until May 1st. Spring break will occur from today, April 8th to April 17th as normal. So what that means is that the students do not need to log on to virtual learning during spring break, as there will be no updated work during this time. The district's focus is on learning, not grades, and has provided much information and flexibility to alleviate academic pressure. So the district would really like the students to focus on getting their work done and actually learning instead of how they're actually doing on their work because of everything else that's going on. The current health crisis is an ever-evolving situation, and the district will continue to provide direction as more information becomes available. So I know it can be frustrating that we do not have all the answers and we don't have an exact idea of when everything is going to go back to normal. But since the situation's evolving, the district is doing its very best to keep everyone apprised as information comes available to them. So talking to your kids about COVID-19, it's important to keep it age appropriate and to follow your child's lead. So not all children are as interested in understanding the virus, and not all information that we hear as adults is necessary for children to be aware of. If you don't know the answer to a question and that they ask, it's okay to be honest with them. So it's important to, like we said, keep it age appropriate and to make sure that you're being candid with your kids. If you don't have the answer to something, it's okay to tell them that you don't know. So focus on helping them feel safe. Remain positive and explain to them that the ways you both can help to stay safe. Washing hands often for at least 20 seconds, covering your coughs and sneezes, avoiding touching your eyes, nose, and mouth with unwashed hands, clean high-touch surfaces in your house daily, don't share personal items, and practice social distancing. There are many songs that last 20 seconds for younger kids that you can tell them to sing as they're washing their hands, Happy Birthday being one of them, to make sure that they're washing their hands for the right amount of time. And allow your child time to express their fears and worries. This is a new scenario for all of us, which can bring up uncomfortable emotions. Validate these feelings and remind your child that this is a temporary situation. So we have some myths and misconceptions from the CDC website. So a myth is that I can contract COVID-19 through packages in the mail. COVID-19 spread from person to person through respiratory droplets. There's no evidence to support the ability to contract the virus through packages or through food at this time. Another myth is that social distancing is not working because the number of cases continues to increase. So the fact is that social distancing is working to flatten the curve of cases. As more testing sites become available, the number of reported cases are going to increase. However, that's not indicative of the health crisis necessarily worsening. COVID-19 only impacts adults and those who are immunocompromised. The fact is that while COVID-19 may impact select populations more significantly, anyone's at risk to contract the virus. A myth is that you can catch COVID-19 from animals, including your pets. The fact is that at this time, there's no evidence to support that animals or pets in the United States can spread COVID-19 to people. There have been no cases of animals spreading the virus to people in the United States, according to the CDC. A myth is that I should wear a surgical face mask or N95 respirator to protect myself from contracting COVID-19. So this has been kind of an evolving situation, and we've been getting a lot of different updates on this. The most recent update from the CDC is that the CDC recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain, i.e. the grocery store and pharmacies, especially in areas of significant community-based transmission. These cloth face coverings are recommended, are not surgical masks or N95 respirators. Those are critical supplies that must continue to be reserved for healthcare workers and other medical first responders, as recommended by the CDC guidelines. So what that's saying is that while it's recommended to cover your face if you're going to be in a social setting, it's recommended that you do not use surgical masks because we are experiencing a shortage of those supplies, and it's important to make sure that first responders have those available. A myth is that COVID-19 cannot survive in warmer weather. At this time, it's unknown whether weather or temperature impacts the spread of COVID-19. So according to the CDC, some people are thinking that it might be impacted by warmer weather because similar viruses have been impacted by that. But at this time, we don't have any information on that. So this is a cute little cartoon that we have about social distancing. So social distancing does not equal emotional distancing. There's a difference between being alone and feeling lonely. Encourage your children to connect with family members and friends through video and phone calls, emailing, texting, writing letters, etc. during this time of physical distancing. Netflix Party allows children to set up an invite-only event where they can watch a movie or show at the same time. So that's an extension that Netflix has released where a child can FaceTime with their friends and they're watching things at the same time and they can both pause it or start it at the same time. So it's kind of like having a movie night while social distancing. Set aside time while you're all home to enjoy quality time together. Schedule a game or movie night. A lot of the kids that I see have been saying that they have been enjoying the quality time they've been having together with their families. Allow your children to get outside when they can. Limiting exposure to others continues to be important, so keep that in mind when getting fresh air and exercise. So it can be sort of a mixed message that public spaces are currently closed, but the CDC is not recommending that you do not go outside. They just want to limit the amount of places where people gather together. And so you can still go for a walk, you can still get fresh air and get exercise, and that's beneficial to your mental health. Just make sure you stay 6 feet apart from people you're not sharing a living space with. And be mindful while practicing social distancing. Children may be utilizing technology more as it's their primary way of connecting with their peers during this difficult time. So I know typically families most likely have rules and regulations on screen time and things like that. And it's important to kind of keep in mind that that is the primary and one of the only ways that kids are getting any kind of socialization or interaction right now. And so the typical guidelines might need to be relaxed a little bit more in order to make sure that children are still having an emotional and social connection.
So for everyone, during this time period, we need to take a second to recognize that we are all going through a lot of change and we are experiencing a lot of loss at this point in time. So when we are talking to our children, our students, even our family members, it is important to recognize that there are some losses transpiring, such as rites of passage. Our juniors, unfortunately, their junior prom had to be canceled due to the health concerns and the safety of others. Rutgers University released just last week that their graduation ceremony that was supposed to transpire in May has been canceled, and they're in the process of trying to figure out ways to postpone it or continue a celebration at a later time. Our routines are being drastically changed. Our students, as everyone can see, are now doing their schoolwork online and doing it virtually from home. Many people now are working from home and are learning how to become both a parent, teacher, as well as a coworker, and managing that throughout their everyday. Our students are no longer participating in extracurricular activities. Track, softball, baseball, activities that they typically participate in during the spring needed to be canceled due to the safety and the wellness of others. Our socialization has also drastically changed. Students are typically looking forward to the lunch period during the school day where they get to see their friends, where they get those in-person social connections. Unfortunately, again, due to the climate, we're not having that in-person connection anymore. Our youngsters aren't having their play dates in person anymore. So we need to be creative with how we still maintain those social connections, like Mary Kate had referenced earlier in the presentation. Our contact with family is also drastically changing as well. There are many nursing home facilities that are not allowing outside visitors to come in. And if visitors do need to come in for whatever reason, there are certain protocols in place, such as taking one's temperature or asking a questionnaire before they come in contact with any older adults or those that may be at a higher risk. Our consistent safe person or place has also changed. There are a large number of students who really look forward to going to school and have that strong connection with their counselors or their teachers. And even though we still are maintaining those connections through technology, that in-person feature is no longer there. And it is also important to recognize that our rituals and our celebrations are changing. Our birthdays are now becoming virtual. There are a lot of individuals that are having virtual birthday parties via Zoom, or having the birthday parades where people will drive by the house. Our holidays are going to look a lot different between Passover and Easter coming up. Weddings are being rescheduled. Funerals as well is looking a lot different from what we're typically used to seeing or being able to participate in.
To add on to what Jen was saying for this slide, I see a lot of kids of all ages privately for therapy as well. And a lot of things that have come up are, I have a 9-year-old that's worried about when she's going to have her birthday, or I have a 12-year-old that had tickets to her first concert and the concert's been postponed. And while it's important to remind kids that this is temporary and you can celebrate differently or attend these things at a different time, it's important to recognize, especially for kids, that this is a loss for them. Things that they look forward to are, they're changing. It's difficult in order to be able to hold on to that hope for the future sometimes when kids are younger. And then things you might never have thought of. I just spoke with someone I treat today who was saying that they were unable to find kosher food for Passover. And so there are things that have to do with this that people weren't necessarily expecting. And so it's important to validate that.
And as we start to cope with our new normal, like Mary Kate began to touch upon, it is important for us to acknowledge that this is a new reality. When we sit down with our children, we need to explore what we do know, be upfront and honest, and it is also okay to say, I'm not sure about that. How about we look into that information or find out more on that topic? We want to honor and remember our rituals and the things that we may be losing out on, like Mary Kate just referenced. One of her students is missing out on their first concert, and I'm sure it will be rescheduled, but that's an event that that child was looking forward to. And it is okay to feel a sadness or a frustration or even an anger around missing out on certain things. In terms of coping with a new normal, we also want to validate, listen, normalize, and encourage our children as well as adults to express their feelings. There is going to be feelings of disappointment. There is going to be feelings of loss of control. But we want to try and encourage resiliency and looking towards the future and moving forward. We want to use something called positive reframing, in which one word can change our attitude. It's acknowledging what we have, not what is lost. So for example, a term that I've been hearing quite frequently lately with some of the students that I work with is, I'm stuck at home. I can't leave my home. I can't see my friends. And reframing that from the I am stuck at home to I am safe at home can help reshape how we think and conceive what is transpiring. And in our next slide, we do have additional examples of ways that we can shift our mindset. So like I said, I'm stuck at home. We can reframe that into, I am safe in my home with my loved ones. I am safe at home. The thoughts of, I will get sick. I will practice safe social distancing, self-isolation, and washing my hands to decrease the chances of getting sick. So that's bringing back the control into that person's life and that thought process of, yes, it's possible that I can get sick, but this is how I can keep myself safe and try and protect myself. I will run out of items I need during self-isolation. A way to reframe that is, I have everything I need for now. I will use my items wisely. Everything around me is shutting down. I'm panicked. Essential places like grocery stores, pharmacy, and medical centers are still open. I will be okay. Those essential places are still there. There's too much uncertainty in the world right now. We can reframe that to, I can't control the situation, but I can control my actions. Keep informed, look after myself, and act responsibly to help at this time. It's important to recognize and acknowledge the things that we do have control of and what helps keep us safe during an especially difficult time in our lives. So we're going to transition a little bit from COVID-19 and explore what stress is, what anxiety is, and talk about coping strategies to deal with both of those on their own, but also how to cope with the pandemic as things change on a day-to-day basis. So what is stress? Stress is any uncomfortable emotional experience accompanied by a predictable biochemical, physiological, and behavioral change. So what does that mean? That means that stress affects not only our physical well-being, but it can affect our behavioral well-being and our emotional well-being. It's a state of tension related to our body attempting to cope with its environment. It's the body's way of preparing to meet a tough situation. Now, stress is normal. It's a response that our body has to help us perform under pressure. Stress is what helps push us and motivates us to study for that big test, to complete that project for work. It helps encourage us and motivates us to get through a task and on to the next thing, and also keep us safe. I am going to kindly ask again if everyone could please mute their microphones for the presentation. And if you have any questions or concerns, we can address them in our chat box.
Yes, so the chat box we're going to be, we have our two other clinicians that are monitoring it and they're writing down all your questions. So be aware, we're not ignoring your questions. We're going to address them all together at the end.
So we're going to explore some symptoms of prolonged stress. So stress, as I said before, is a natural reaction to a difficult or challenging event. But prolonged symptoms of stress, if that stress is ongoing, we can start to see behavioral, physical, and emotional changes. So some behavioral changes, both in children as well as adults, is we may see changes in behavior in terms of eating. Some individuals will start overeating. Some individuals will stop eating at all. There may be an increase in use of drugs or alcohol. Some individuals may begin to isolate or engage in social withdrawal. There may be other behavioral things like nail biting, hair pulling, or even disruption of sleep. Some symptoms of physical stress can be shortness of breath, muscle tension, indigestion, neck and back pain. I know for myself personally that when I do experience stress, I start to feel it in my upper shoulders and I start to feel very tight. And there can also be emotional symptoms of prolonged stress that do come out, like anxiety or restlessness. Especially in our young kids, we'll see things like mood instability, or feeling nervous or jumpy, or difficulty even concentrating and focusing.
And no one is really kind of immune to these stress responses. I mean, even, like Jen said, she feels it in her muscles and her neck. Last night I had a nightmare about the virus. I guess I've been talking about it too much. And so it's okay to be a little bit easy on yourself, acknowledge the stress that you're having instead of just pretending it's not happening, address it.
So what is the difference of stress versus anxiety? So stress is normal. It can be adaptive. Like I had mentioned earlier, stress can motivate us to get through those difficult or challenging times. For instance, a student preparing for a big test, it can motivate them to study and to do what they need to do to try and learn that information and do overall well. But it's when stress is excessive or ongoing, it starts to interfere with functioning, and that's when stress is a problem. But we need to remember that stress is temporary and anxiety is ongoing. So when stress starts to become anxiety and it continues and it's something that doesn't stop even after we take the test, that's when we need to be concerned. So according to the National Institute of Mental Health, approximately 31.9% of 13 to 18-year-olds have an anxiety disorder, and 8.3% have a severe anxiety disorder. Now, according to the statistics through National Institute of Mental Health, those numbers had actually gone up 7% from 2018 to 2019. So anxiety disorders are the most commonly diagnosed mental health disorders. I'm sorry, I'm just going to pause the presentation real quick to see if I can mute the microphones that are currently on.
Not that we didn't love the piano playing before, it was beautiful.
Okay. So, as I said, anxiety disorders are the most commonly diagnosed mental health disorders. Now, while some anxiety can be productive, it can also keep us alert and out of danger. We want to be concerned and make sure that it's addressed when it's constant, uncontrollable worry, fear, or dread that is not based on rational facts and can cause someone to withdraw from activities or change their behavior. So if that anxiety becomes constant, I do highly encourage you, whether it's a child or an adult, to reach out to either your primary care provider or even a psychiatrist or a therapist to start to talk about ways to go about managing that anxiety or how you can go about engaging in treatment. So some signs of anxiety in children, especially our young kids, 2 to 12 years old, we see a lot of somatic complaints, such as headaches or stomach aches, that even though they are going to the nurse's office or say they're being brought to their pediatrician, there's no found physical reason for them to be experiencing headaches or even stomach aches. These can be signs of anxiety in kids. Our young kids do not have the cognitive abilities or even the language skills yet to say, I am anxious. And that is how they will communicate those feelings. Some other signs of anxiety in children is avoidance, tantrums, crying, refusing to go to school, periods of emotional or behavioral disruption when there is a change in routine, whether it's before going to school, after school, or even going to an activity. Additional signs of anxiety can be difficulty settling down for bed or even having nightmares or disrupted sleep. So what do our kids do? Our kids are family members, they're friends, they're students, they have homework. Some of our kids work, volunteer, or intern. Our kids are in band, sports, after school clubs. They have responsibilities at home. They have chores. They participate in special programs. And some of our kids are even participating in college-bound programs. Now, the reason we bring this up is compared to 30 to 40 years ago, our kids are involved in so many more activities than they used to be. And they are juggling a lot. And unless they have the coping strategies to deal with all the challenges or even activities that they are participating in, this is where the stress and anxiety can start to heighten. And we want to promote those wellness activities for our kids so that they know how to handle a difficult situation.
So technology during the pandemic. So we touched upon this a little bit earlier, but we wanted to go into a little bit more detail. So there's a lot of positives to the amount of technology we have now during this time. So technology allows us to stay connected with friends and family. Text, FaceTime, Netflix parties, and then I listed some other things here. House party app, tabletop simulator, which is a way to play board games virtually online. And so they have classic board games you can play online. There's a game called Jackbox that if one person physically owns the game, other people can join via cell phone. So there's a lot of different ways to stay connected. Maintaining important social connections that students are missing out on being in school. So school is not just learning, it is the primary source of socialization for kids. And so without that, their social connections are feeling very severed. Google Classroom for educational instruction. So I know that the WWP instructors have been utilizing Google Classroom in order to have virtual instruction. Communication with teachers and counselors, enhancing our creativity by sharing ideas, music, and art, meet and interact with others who share similar interests and communicate with educators and fellow students, and even the ability to volunteer or get involved in campaigns and nonprofits. And so having this technology allows us to do a lot while social distancing. There are also some negatives to the amount of technology we have at our fingertips. Increased potential for cyberbullying as kids become frustrated and isolated on their own. The more connected we are, the more opportunities we have to make poor choices. Exposure to news and world events. So the constant exposure can heighten anxiety. So I tell a lot of the kids I see to either not look at news articles or to limit yourself to 1 or 2 news sources a day, because I have kids that have an alert on their phone for anything about COVID-19. And right now that is everywhere. So they are getting constant notifications about it, and it's making it seem like things are more oppressive than they actually are with the notifications. Without meaning to, kids can share more online than they should. And excessive screen time due to limited options for socializing. As we said before, excessive screen time does have downfalls and negative effects. However, the negative effects of feeling so socially isolated at times might outweigh the negative effects of having more screen time. And so it's important as a family to decide how often you are allowing your child to connect, but to make sure that you're keeping in mind that that's right now the only way that they can feel connected to their peers.
So social media, what can parents do? So it's important to be aware of what your kids are doing online, but we don't want to alienate their or damage their trust, that you built together. So the key is to stay involved in a way that makes your kids understand that you respect their privacy, but you also want to make sure that they're safe. So before your student starts using a social media account, or even if they are using an account right now, you want to make sure that you have a conversation with them to encourage them to be nice to others. We want to discourage cyberbullying. Today, students go to school, they come home, and they're still connected to that social media and those friend lines, where there are a lot of pros to that, which Mary Kate just addressed, but sometimes they have a difficult time turning that off and disconnecting. So we want to talk to them and encourage them to be nice and to discourage cyberbullying. We also want our students to think twice before hitting enter. Are we sure we want to post that? What would grandma say if she saw that I was posting this online? Would she be happy about this? Would I want her seeing this image? Or would she be upset that I'm posting such a thing? So WWGS is a little acronym that I sometimes use with my students. They usually get a good laugh out of it, but it really helps them reframe and think, wow, do I really want this out there? Do I want people to see this or hear this? We also want to encourage our students to use privacy settings. If a profile, say for instance, on Instagram is not private, anyone can access that, anyone can add them as a friend, and we want to make sure that they're practicing safety while using social media. We also want to encourage them not to friend strangers. Again, that goes back to using our privacy settings. And the biggest thing of all is it's important to talk to our kids about making a contract. Yes, our phone is fantastic because we can use it to connect to anyone at the drop of a dime. We can talk to our parents, we can talk to our friends. We can also reach out to extended family members, especially right now, that we can't see. But we want to make sure that we're not glued to the screen and we're not glued to our social media. So we want to make sure that students understand that there's a time that needs to be allotted for family where we disconnect. There's a time where we're going to be participating in our schoolwork. And then there's going to be some time where we're going to be using our technology. Now, the other piece that parents need to remember is that if we are enforcing a certain rule with our students, we should try and follow those rules as well. So for instance, if we're saying we don't want to use our phone or text and drive or have our phone at the dinner table, as parents, we need to enforce those rules upon ourselves as well. Because what students and children are seeing their parents do, they're going to end up either mimicking it, or it's going to make the rules that you're putting in place a little bit harder for them to follow.
And I just wanted to add, in addition to what Jennifer was saying, that as I mentioned earlier, when talking to my students and the kids that I treat, that about unexpected benefits or things that they are enjoying through all of this. The number one thing is unexpected family time. I had a kid saying that their family's been having a 3-day game of Monopoly, and they can't remember the last time they were able to keep a board game going for so long without people being so busy. So it's really important to allot that time. And then when I have other kids saying that families are all staying in their separate rooms for days at a time, and that's increasing the amount of isolation they're feeling. So definitely keep in mind how important the family time is, especially during this current health crisis, and maybe appreciate that we might have more time to spend together during this time.
The other piece that I do just want to add into that is I'm seeing some private messages asking what's the appropriate amount of screen time for my child now that they're home. And what does screen time look like for someone who's, say, very young and either in kindergarten and first grade versus high school. So I know we are going to address questions at the end of the presentation, but I did just want to bring this up right now. That does need to be an individual and family decision. But when making that decision, I would also consider the topics that we have discussed today, such as this is for a lot of kids their way of connecting with their friends. So we want to be understanding of that and provide students that opportunity to connect with each other, but also set those appropriate boundaries that your family agrees upon and decides upon.
And I, just adding as well, as what Jen said, we're not telling you how to parent, or that's really an individual decision per family. But to try to keep in mind that now we're on spring break now, but in general with social, the way school has been, the fact that school is all virtual, yes, that's a lot of screen time, but the kids are not using that in order to socialize. And so to try to keep in mind balancing the amount of screen time, but also understanding that when they're on Google Classroom, they're doing their schoolwork, they're not using that to, you know, talk to their friends. And so it's important to have that connection as well.
So we're going to transition to talk about healthy coping strategies. So a healthy coping strategy that I encourage all the students that I work with is to engage in positive self-talk. So it is very easy for us to resort to negative self-talk, such as I'm not good enough, or I didn't do well because of X, Y, and Z. We want to encourage positive self-talk and remind our students, you're not expected to be perfect. Sometimes you will make mistakes, but let's focus on the positive things. You got an A on that test yesterday. This time you got X, Y, and Z. What do we need to do to improve for the future? Part of our healthy coping strategies is taking care of ourselves. We want to make sure that we're getting enough sleep at night. If we're not getting enough sleep at night, there are a lot of studies that show that that can overall affect our mood, the way we think, the way we process information throughout the rest of the day. In terms of taking care of ourselves, we also want to exercise. We want to make sure that we're maintaining our nutrition. At home, there's a lot of food around. I know I am guilty of it with not maintaining my usual food schedule, and I need to get myself back on it. It's a lot easier to go into the kitchen and make yourself something to eat. We need to maintain that nutrition. Mindfulness, which we're going to talk a little bit about in a couple of minutes, is the power to stay in the moment and to recognize the moment. Meditation and breathing exercises can also be very helpful. Music and art, journaling, spending time with our animals or our pets if you have them, talking it out with other people. As long as it's immediate family members and you have consent, the power of physical touch can be really powerful. Using a strength focus approach. So like I said before, focusing on your strengths and what you are able to do successfully. Laughter and happiness, these are all healthy coping strategies. So we are now going to watch a mindfulness video. Mary Kate is going to turn up the volume for this video. If for whatever reason you cannot hear the video, please just write it in the chat box so that we can try and adjust as needed. It's a 1-minute video.
Sorry, I was seeing a lot of no sound. Hold on 1 second to make sure that all my volumes are up. Ah.
You may have heard this word mindfulness.
I turned on closed captions as well.
I'm going to give you one simple, serviceable definition, which is this. Mindfulness is the ability to know what's happening in your head at any given moment without getting carried away by it. Imagine how useful this could be. Just as an example, driving down the road and something cuts you off in traffic. How do you normally react? I think most of us, we normally react by having a thought, which is, I'm pissed. And then what happens next? You immediately, habitually, reflexively inhabit that thought. You actually become pissed. There's no buffer between the stimulus and your reaction. Just a little bit of mindfulness. In that same situation, you might notice my chest is buzzing. My ears are turning red. I'm having a starburst of self-righteous thoughts. I'm getting angry. But you don't necessarily have to act on it and chase that person down the road, screaming at them with your kids in the back of the car, thinking you've gone nuts. Now, you might be thinking, don't I need to get angry sometimes? Aren't I justified? I would say yes, but probably not as much as you think. The proposition here is not that you should be rendered by mindfulness into some lifeless, non-judgmental blob. The proposition is that you should learn how to respond wisely to things that happen to you, rather than just reacting blindly. That, my friends, is a superpower. How do you get it? The way to get it is through meditation. I believe that meditation and mindfulness are the next big public health revolution. In the 1940s, if you told somebody you were going running, they would have said, "Who's chasing you?" But then what happened next? The scientists swooped in. They showed that physical exercise is really good for you. And now all of us do it. And if we don't, we feel guilty about it. And that's where I think we're headed with mindfulness and meditation. It's going to join the pantheon of no-brainers like brushing your teeth, eating well, and taking the meds your doctor prescribed for you. Let me just close by saying mindfulness is not going to solve all of your problems. It's not going to render your life a nonstop parade of unicorns and rainbows. Nonetheless, this is a superpower, and one that is accessible by you immediately.
All right, so what are some mindfulness activities that we can do at home? So the first mindfulness activity I'm actually going to walk everyone through, and I know our videos are off, but I am going to trust that either individuals are listening or are going to practice it. So the first strategy I'm going to talk to you about, which works really well with our kids, is 5-finger breathing. So if everyone could put their hand out in front of them, spread out their fingers. So with 5-finger breathing, we want to start at the bottom of our thumb, and we want to trace our hand as if we're tracing our hand onto a piece of paper. And when we trace up our thumb, we want to take a big deep breath in. And when we're taking that big deep breath in, we want to inflate our body with so much air that our stomach starts to expand. And when we go down our finger, we want to blow out that breath so that entire breath comes out. This is also known as smelling the flowers and blowing out the candles. So with our 5-finger breathing, we're going to take a big deep breath in. We're going to take a big deep breath out. I'm going to kindly ask everyone, please mute their microphones again. Take a big deep breath in. Big deep breath out. And we're going to keep doing that. In. Out. Big deep breath in. Big deep breath out. Big deep breath in. And one more time, big deep breath out. So with that activity, it's a good activity to use, especially with our younger kids, because it gives them a visual of what they need to be doing to breathe in and also to breathe out. So again, we want to try and use that activity with our youngsters or even our older children to help show them how we should be breathing and to help self-regulate, especially during periods of time where we're feeling anxious. So belly breathing, that's exactly what I had just described, but the 5-finger breathing is more of a visual to use. So that's taking the big deep breath in, filling up our bellies and blowing it out. Color counting is another popular mindfulness activity. So starting with the colors of the rainbow, we want to sit in a room with both of our feet planted on the ground, trying to put both of our hands flat on our laps and to look around the room and start trying to count the colors of the rainbow. So starting with the color red, how many things in the room do we see that are red? We may go through the room and count 5 things that are red. Okay, we want to take a mental note of that and then proceed on to orange. How many things in the room are orange? And continue that until we get to the color purple. One of the challenges I do with the kids that I work with is when we do color counting, not only do we want to recognize how many things are in the room of that color, but at the end, we also want to reflect back and say, okay, so the color blue was most popular in this room. There were 8 things. The color yellow, there was only 1 thing. Just a reflection of our mindfulness, our surroundings, and reflecting on the moment. 5 senses body scan. So that is exactly what it sounds like. We want to take note of our 5 senses. What are we hearing? What are we seeing? What are we tasting? What are we touching? We want to go through all those 5 senses. Online, you can purchase a mindfulness card deck, which can be a really fun game to do with your family members, and it will provide you in the moment strategies of things that you can do together. Guided imagery, there are a lot of things on YouTube that can talk you through guided imagery, as well as things to help keep you in the moment. And a really great app that students, adults, anyone can use is called Headspace. It has videos anywhere from 30 seconds all the way to activities that are a lot longer. There's a good amount that is free, but there is some that you do have to pay for, but it can be a really great option for those that are looking for some in the moment mindfulness activities. Some additional mindfulness activities, if you're looking for something else to do, can be drinking water. Is the water warm? Is it cold? Is it refreshing? Do I feel thirsty? Do I feel parched? Play-Doh is a really great strategy, especially for our young kids. Playing with erasers, stress balls, fidget spinners, playing with a slinky, watching it going up and down the stairs, watching the movement. And progressive muscle relaxation, which is a means of being in the moment, but also tensing up our body and releasing our muscles and going from body part to body part. So starting all the way at the bottom at our feet, working our way up through our legs to our shoulders, all the way up to our mind. And we don't want our mind to be full, we want to be mindful. So being in the moment and not thinking about all the things in the past or thinking of the things that are coming in the future.
Yes, and that's what I was going to add, that anxiety has us living in the past of things we can't change or things in the future that are coming up that we have no control over. And these mindfulness activities sound very simple, but they're very powerful in the sense that they force you to focus your attention on the present moment and to stop living in that anxiety. So while they sound very simple, it's very powerful, especially for a child, to be able to force them to kind of live in that present moment.
So the presentation is probably going to go for about another 10 minutes. We have a few more slides to get through. I know there's some people who are asking privately in the chat how long the meeting is. So we should be going for about another 10 minutes before we address questions. So in terms of parent support, we want to be aware of our child's behaviors and their emotions. We want to pay attention. Is there any changes in their mood? Is there any changes in their behavior? Are they starting to act out more, especially with changes in the pandemic and now being home often? We want to build trust with our child. We want to encourage them to talk to you and let them know that it is okay to express their emotions, especially if they're feeling any certain way regarding the fact that their new normal is what it is. We want to be available and open to talk with our kids, especially when they are ready. Encourage the expression and validate their feelings. We want to teach and model good responses. So we want our children to learn from us what their reactions should look like. We want to help them navigate their situation in a responsible manner. So if a child, for instance, is having a tantrum, distracting them from that tantrum and then encouraging them to talk openly. Okay, this is what's happening. This is why I'm mad. This is why I'm sad. And like I said earlier, we want to encourage our children to talk to us about how he or she is feeling. So, okay, go ahead.
So additional parent support, so creating a self-care toolbox for you and your children. And so that can be metaphorical or a literal toolbox of things that you can do to take care of yourself and to distract yourself. Coping skills, breathing exercises, hydration. I sometimes encourage my kids to come with a little shoebox and to put in things that would help them calm down if they're having a very anxious moment. You know, pictures of positive memories, you know, a new thing of Play-Doh, things like that. Breathing exercises, spirituality, distracting activities, reading a book, watching a movie. Comfort activities, playing with a pet, taking a shower, talking to a friend, a release of energy of some kind, whether that's exercising or yoga, expressing yourself, singing a song, dancing, arts and crafts. Empowering, writing positive things about self, gratitude list, enjoyment. Mindfulness, teaching your child to problem solve, and reminding your child that they'll get through tough times, particularly with the love and support of family and friends. A lot of the younger students I work with are utilizing a lot of arts and crafts, and something that I've been doing is telling them to create art with the intent in mind to give it to family and friends that they're not able to see right now. So they'll have a plethora of things to give to people when you can see them again, because it inspires hope. Keep your child aware of anticipated family changes. So Jen, I believe you had something about that.
So in terms of family changes, we do want to let our children be aware of what may be happening. So for example, I do have a student that I've been working with that they weren't aware that they were not able to go visit their grandparent in the nursing home for their birthday. And it came to them a bit of a surprise when that day came and there was no plan in place. So if you're anticipating anything like that is going to happen, I would bring that up to your child and have an honest conversation with them so that they are aware of what to expect. And if you aren't sure of what's going to happen, that is okay to say that too. Recognizing, hey, I don't know if we can visit grandma today, but here's what we're going to try and do to figure it out. Do you have any suggestions how we can still celebrate that?
Monitoring television programs that could worry your child. So being mindful of, if you're watching the news, how much your child is absorbing from that. Pay attention to the use of computer games, movies, and the internet. Use encouragement, natural consequences when poor decisions are made. Help your child select appropriate extracurricular activities and limit overscheduling. Monitor your own stress level. Contact your child's teacher with any concerns and make him or her part of the team available to assist your child. Seek the assistance of a physician, a school psychologist, school counselor, or school social worker if stress continues to be a concern. Though school has transitioned to being virtual, our school staff is still very much working when school is in session. And so you are still able to email your school counselor for additional support.
So the school district does have support available to parents and students through the following links. Again, this presentation will be posted on the district website and will be available. So there are mental health, academic, social, and emotional learning resources available through the West Windsor Plainsboro School District website. There's also a Google Wellness website, which is as part of the district's commitment to supporting the health and well-being of our school community. The purpose of the site is to promote the understanding that wellness is an active process of becoming aware of and making choices towards a healthy and fulfilling life. Students, families, and staff are encouraged to use these self-care resources in their daily routine. So it's a very wonderful place to go to for any tips or strategies that you're looking to use. And there's also the virtual field trips and experiences through Dr. Outerhold's Spring Break Padlet. And it's a really great thing, especially for our youngsters and even our older kids to look at, to have those experiences, like going on vacation and going to Disney and what they could experience one day. So these are some mental health hotline resources, which are really great for our youth as well as for adults. So there's Second Floor Youth Helpline of New Jersey. This is actually monitored through an agency in the state of New Jersey, through Rutgers. There is a text option, call option, as well as an online website where students can use the group messenger box. There's New Jersey Hope Line. The state of New Jersey is extremely proactive when it comes to mental health. They noticed quite a few years ago that there were a lot of dropped calls when people were calling the National Suicide Prevention Hotline. So they developed their own suicide prevention hotline where it's answered here in New Jersey, and people are connected to a live person almost immediately. There's also the crisis text line. So if you text home to 741-741, you can connect to a crisis counselor. There's also a chat feature available through Facebook Messenger. And if you are looking for an emergency service or to have someone seen in person because you are concerned about overall safety, there's Rutgers University Behavioral Healthcare Acute Psychiatric Services. The 855 number is there. It is a psychiatric emergency room and is separate from a medical emergency room. So when an individual does go there, there are mental health clinicians, nurses, as well as psychiatrists on staff that are able to provide an evaluation, and again is separate from a medical emergency room. And there is also the phone number for Princeton Medical Center ER. One more side note for the second floor youth helpline of New Jersey, just so everyone is aware, a student does not need to be in crisis to call that phone number or text that phone number. If, say, a student is experiencing an anxious moment or a moment of distress, it is a really great resource for students to talk through concerns that they are having with a live mental health clinician.
Yes, I used to personally volunteer at Second Floor Helpline, and a lot of times we would get phone calls of people that are just having a lonely or down moment and didn't have anyone at the moment to talk to. And so it's not necessarily for just in crisis, it's for anyone that wants to talk to a professional and feels that they have no one to talk to at the moment. We have some links for other mental health resources. So there's a link for Carrier Clinic, which is a mental health inpatient unit. We have the link for Perform Care, which is a free resource for families in New Jersey that can contact Perform Care and have a mental health professional come out to your house through their mobile response team if your child is in crisis. There are certain higher levels of care, Gen Psych, High Focus, Princeton House. So those are more intensive therapy treatment programs that have all switched to a virtual platform. So they provide more intensive treatment currently via video sessions for group and individual counseling. Jewish Family Services, Trinity Counseling, and Village Counseling are all outpatient services where you can be connected to a mental health clinician for weekly therapy. And so almost all of these, with the exception of Perform Care and Carrier, because they are in person, have switched to virtual sessions. If you would like more information about additional levels of care, you can reach out to the school counselors who can provide you with more information. All right, so at this time, we are going to be taking questions that Abby and Natalia have been taking down from what you have been saying in the chat box. We want to remind you to continue to keep your microphones muted. If you have a question, to type it into the chat box, and Abby and Natalia will be reading the questions out loud, and they'll be answered by Jen and myself, as well as Dr. McDonald for things that are more related to school procedures. So Abby or Natalia.
Right here, it's Abby. The first question is, didn't Governor Murphy extend the stay-at-home order until May 7th?
So as we were presenting this, that got sent to my phone. So from what I'm seeing right now, yes, he did. So that is not something that we currently had when we created the presentation, but an article was sent to my phone during the presentation about that. So as far as I can tell, the stay-at-home order has been extended.
It has been extended until March. It was extended as of March 9th through May.
So, and all up-to-date information from the governor can be found on New Jersey's website as well.
Okay, the next few questions go towards Lee because they are about school closure. A few parents are concerned about when school will reopen. Will it reopen before June? Some other states have already announced that schools are not reopening. So I will let you handle that one, Lee.
Sure. Thank you, Abby. At this point, we're certainly taking direction from the governor's office, the legislature, and our county and state health departments in terms of school closures. But that's really something that hasn't been determined at this point. I know that people understandably want answers. I will say that Governor Murphy was indicating yesterday that graduation ceremonies and whatnot, end of year activities seem doubtful given what's transpired, certainly in other sections of the country, other parts of the world, in terms of peak cases and whatnot. So, with that said, the district is certainly always been forward thinking. We're going to be forward thinking with regards to potentially what could things like graduation, like other end of year activities look like. So, as we hear more information from Governor Murphy and the governor's office, we'll certainly make sure that our parents know kind of what the next steps are and do the best we can to continue the learning environment that's been established virtually.
Thank you, Lee. Actually, another question just came in regards to school. It says currently teachers communicate to kids using Seesaw. Is there a plan when teachers would directly start interacting with kids? For working parents, it's really difficult to focus on kids' assignments.
So I know additional information was just put out with regards to the K-5 learning platform. I would refer you to that if there's specific questions about in terms of student engagement. I know that our K-5 teachers will be increasing that engagement in the coming weeks as we return from spring break. There is a number of resources that are available online under the learning platform virtual links. But if you have specific questions, I certainly would start with your classroom teacher about that. And then if you're at that point not able to get the information that you're looking for, feel free to reach out to the school administration.
All right, thank you, Lee. The next one is for Mary Kate and Jen. It says, do you recommend trying to maintain a daily schedule at home through spring break? Wake up, outdoor time, off time from devices, etc. I know you guys briefly mentioned on that, but maybe just reiterating what you said.
I would definitely encourage to continue to keep a schedule as much as possible. I mean, there's spring break and we do want the kids to be able to enjoy that. However, one of the kids I worked with, I think, summed it up best and said that this entire quarantine has felt like the week between, the holidays and New Year's, or just like it's a Sunday every day. And so we want, it is best to have kids have a routine, outdoor time when possible, time on screen, time off screen. I would definitely look to relax that a little bit during spring break because we want them to also feel like they are getting their spring break. But definitely keeping busy will help, in my opinion. Jen, do you have anything on this?
I would agree with that, but I would also have a conversation with your kids so that you can come to a agreed upon what's that schedule going to look like. For instance, if there's certain chores that you want done, having a give and take. So listing, these are the things that we need to get done today, like cleaning our room or cleaning out the dishwasher, for instance. But what are some activities that you would like to participate in? And giving them the opportunity to say, I want to go outdoors, or I would like to play Monopoly as a family. So having that conversation so that everyone feels as if they are part of the solution.
Thank you, guys. Next question is, what is recommended hours per day for playing computer games for 12 to 13-year-old boys?
So again, I want to reiterate that, we're not, necessarily here to tell you how to parent and the guidelines for your house. A lot of computer games have the voice chat option where you can play with friends. So I would also consider it to be a way of socializing. There are, if you look at the American physician website, there are guidelines to certain ages and amount of time on screen, but those are not reflective of the current environment that we're in. In my opinion, I would maybe take what you normally allow them to do and add on some additional time. Jen, do you have any insight to this at all?
So Mary Kate is our clinician expert when it comes to video games as well as screen time. So I would definitely follow her lead on that. but also, as we previously had mentioned before, making sure that there is some form of a contract or an agreement so students understand upfront, this is the amount of time that we are going to be using our technology for leisure time. This is the amount of time that we're going to have downtime away from the screen. This is the amount of time that we're having time with family, so that it's a discussion ahead of time. And if limits are set in the future, it's not a surprise to the child and it's something that can be reinforced.
Yes, I would kind of talk to your kids about, here is maybe 3 or 4 hours of leisure time and you can utilize it how you would like. So computer games, video games, phone time, YouTube. So kind of have that outline and leave it up to them how they would like to utilize their leisure time.
All right, thanks guys. We just have, I think, 2 more questions. One of them is, can we get access to the slides you're presenting now? Natalia actually posted in the chat, this presentation is being recorded and it's going to be put on the district YouTube channel at some point. I don't know if you guys are giving them access to your slides directly or if that would be the only way they'd access it.
So to my understanding, as you had previously mentioned, Abby, this will be posted on the district website. Following the meeting, we can have a discussion with Dr. McDonald about seeing how he would like to also share the PowerPoint presentation.
Yes, but the goal is to make sure that, this is available for you to use, especially because we have some links to articles and things like that.
Okay, and the last question is for Lee McDonald. It is about school again. It says, when can we see grades on Genesis?
So currently, K-5 report cards were posted last week. Currently, our 6 to 12 high school teachers, middle school and high school teachers are posting grades. Those will be available April 22nd. April 29th, after spring break. Just with regards to specific class grades, the district made the decision to turn off the grade book. Kind of going back to what was mentioned at the beginning of the presentation, the focus is really on engagement and doing the best that we can in this virtual learning environment. So that's, at this point, still turned off for the foreseeable future.
Okay, and it looks like we did have one more question before we end. It says, how do I help my child learn a new skill during this stay-at-home time? Any points?
YouTube. It depends on the skill you would like to learn. I have some kids that are trying baking, some kids that are trying arts and crafts. There are specific YouTube channels specifically for kids of certain ages to teach them new arts and crafts. So that's something you guys can watch and do together. If your kid is more interested in something a little bit more intellectually stimulating, there's a free app called Duolingo that teaches you new languages for free. So technology, there's a lot out there to learn skills, and you can turn it into family time to learn something new together, so they can reflect back on this and think about, it wasn't just the scary time, we also had this really cool experience together.
So we do actually have one more question. I apologize. This one is for Dr. Lee McDonald. If the schools will be closed for the rest of the school year, do we expect to have live lectures from teachers for some class time? Self-learning is very important, but nothing can replace lectures from teachers. My child is in high school.
That's a good question. Obviously, the virtual learning environment is new territory for everyone, teachers, students, staff alike. That being said, there are a variety of ways that our teachers are engaging students at the secondary level and K-12 for that matter. But in terms of live structured meetings at specific times, there are certainly some teachers that are using the video conferencing feature through Google Meet as an example to host sessions. I think that as we get into the rest of the school year after spring break, you will likely see other forms of that coming forward. But again, that's something that each classroom teacher individually is doing through a variety of means. I think that does it in terms of the questions. At this point, I want to just remind everybody again, our students, staff, families, health, safety, and well-being is our priority. So if there's something that we can assist you with, by all means, please reach out to us. As previously mentioned, we'll get this out on the district website under the counseling department, parent university tab. I'll also make sure that it gets tweeted out through the district website and through our counseling Twitter feed, which is at WWP Counseling. Be well and stay safe, everybody. Thank you.